You would go to this facility if you are having some signs and symptoms that you are unsure of, if you are not feeling well, to ask a question regarding health issues, to fill a prescription, to pick up an over-the-counter medication for minor ailments, to get a flu shot, to review your medication, and to pick up a health supplement.
As this is a very busy workplace, waiting time varies depending on the time of day or your inquiry. Typically, waiting time is 15 minutes for a new prescription, but oftentimes patients opt to come back later on in the day.
Appointments are not typically needed unless you are coming in for a drug usage review or an education clinic. Some clinics that are offered at this location are diabetic clinic, smoking cessation clinic, and asthma clinic.
Stop to shop at Drug Mart located on 5602 10th Line West here in Mississauga to find out more about the Pharmaceutical Center. It opens from 8 a.m., closes at 10 p.m. So we will arrive here at Shoppers Drug Mart. We will meet two different types of healthcare professionals that work here, and we're going to ask them a few questions. Hi.
Hi.
Thank you for taking time to answer some questions for a grade 10 healthcare assignment. First, let's start by asking your name, position, and what you do here on a daily basis.
Okay, so my name is Rita Hanna and I'm a pharmacist, and I've been practicing here for the last 10 years.
My name is Mia Magazine. I'm a pharmacy technician, regulated pharmacy technician, and my responsibilities are multiple during the day. So mostly I enter prescriptions, fill them. I also do pick up inventory management and ordering, basically anything. Yeah.
My name is Braden. Hopefully in the future I'll be a pharmacist. On a daily basis I process, check prescriptions, make sure the medication is dispensed safe, make sure the medication is appropriate for our patients so our patients get the best out of our healthcare system.
What are some healthcare services that this facility provides?
So we have a very busy practice. We fill about 300 prescriptions per day.
Wow.
And we also, so besides filling prescription, we also provide a lot of other healthcare services. We do education clinics on a monthly basis. So we have diabetic clinics. We provide flu shot vaccination, and that's coming up in October and November. We also do blister packaging, and this is where we are now in the counseling room, and this is where we put all our blister package for. This is for seniors who cannot organize all their medication, so we organize it for them on a weekly basis.
All right. What do you like most about being a pharmacist?
My favorite thing about being a pharmacist, I think, would have to be being able to make a difference in people's life. I think pharmacist is a very trusted healthcare professional, and we're very accessible, so people can come in and ask questions. It's so easy to, we're very easy to talk to.
So what do you like most about being a pharmacy technician?
What I like the most is dealing with people and being able to help them get their medications faster and the correct medications.
Yeah.
And just being part of that circle of care.
Okay. What are some of the requirements to become a pharmacist?
So with most professions, there's you got to get your university credentials there. So for pharmacists, you need to do, at minimum right now, it's 6 years in total. So 2 years undergrad, 4 years at pharmacy school, and then also pass the board exams and things like that. Then after that, essentially, you can be a
What do you do to keep the pharmacy a safe, clean, and trustworthy environment?
We are all the pharmacy staff, like pharmacists, pharmacy technician, the student, pharmacy assistant. Everybody's trained to work in a safe environment. We make sure we look at the drug wall on a regular basis to check if there's any expiry at least once a month. And everything that's expiring in the next 6 months would have to have a label on it. So we do that on a regular basis.
What are your opinions about the Canadian healthcare system compared to other healthcare systems such as the American healthcare system?
I think that we have a better healthcare system because it's universal, so it's free to everyone, regardless of your socioeconomic status. Like versus like the American system where people don't have free, free coverage for their medications or doctor's visits.
Yeah, I think we're very, very lucky to be living in Canada and to have the healthcare system that we have, a universal healthcare system. It doesn't. Everybody gets the treatment if they need to, and this is not available everywhere else. So I think we're very, very lucky.
So what I like about the Canadian healthcare system, and I know a lot of people think of this as a bit of a fault, is that I like the fact that everyone's covered, that you can kind of live your life knowing that if an emergency happens, that you won't have to worry about like your finances to make sure to help you get you back on your feet, kind of thing. Of course, there are some downfalls with the Canadian healthcare system. Things like long wait times and stuff have been a bad trend for the Canadian healthcare system, but overall, I think it's better than the U.S.
Okay. Thank you so much for your time and helping us get a better understanding about the pharmacy.
You're very welcome.
Thank you.
So we've just left Shoppers Drug Mart, and we just want to say thank you to everyone who helped us with the filming of the video and helping us get a better understanding about the pharmacy.
Thanks for watching our presentation.
Muévete a mi ritmo, siente el magnetismo, tu cadera es la mía,